And everyone aware that heart failure is an emerging threat in the worldwide. As per the data and report, almost 63.93 million people are suffering with heart failure worldwide. So if we compare with any other disease, heart failure is it's huge burden. It's in terms of an disease which will be causing. It's compared with the other diseases. It is not if the heart failure management concerns. It is a complexity in nature of the disease in terms of diagnosis and investigation in management concern also.
India took a little lead from all the other countries to give the nurses. South was much ahead of North. India could give many good nursing facilities all over the world. But this country went for quantum, not for quality. And what happened? Today we have got 27 lakh nurses all over India. Maybe a little more, or the numbers are not very sure, but in few lakhs we have got nurses working for the country. But what I see that post-graduation in nursing education still is grossly lacking.
And an estimated cost of $31 billion per year. Also, there is 2% prevalence of heart failure in the general population, and over 10% of those cases are patients those who are aged about 70 years. Today, even if we have improved our health system and treatment modalities, prognosis of heart failure still remains poor. For example, Greece faced heart failure pandemic, representing the clinical and economic burden of heart failure in Greece. The authors demonstrated, despite progress in the management of this chronic disease, about 25% of the patient died during hospitalization and 40% re-hospitalized within 1 year, and in addition, mortality rate after discharge from the hospital has reached.
Nurses working in the hospitals and students from first year, second year, fourth year is to be concerned to think about and do the better management. It is not only with the only physician. We need. This is the statement given by John Hinton, medical attending physician, 1963. He given a statement. He said, "Easier to die of cancer than heart or renal failure." Instead of the patient going for transplantations, the patient may survive 5 to 10 years with this device. So that everyone know about structures of the heart. I don't want to give very basic about you. That's a very good, very beautiful structures. Both chamber regulated by the heart. Another disease is called electrophysiological function. Anything which has been due to arrhythmia or any other problem, but ischemic heart disease. And again, we will tell them go for angio, treat the patient. I told you that is the heart is functioning for systemic and pulmonary for advanced life support. You will able, and also the patients who are with atrial fibrillation and other arrhythmias. That is very common arrhythmia because this is we can say the characteristics. We can say that how the B1 and the pattern of this B1 and B6. Again, the patient also with the X-ray, because today our nurses, heart failure nurses who are working, and other investigation is echo. Echo is the most important because even our heart failure nurses, they go for almost 1 month training to do. Again, dilated cardiomyopathy also can be diagnosed through the echo. And contrast angiography, that today everyone who is suffering with ischemic heart disease immediately to mobilize for the angio, because we understand that mostly, you can say that out of 100 patients, 6. Again, MUGA is another one. It's multi-gated scans, nuclear medicine test that make you understand the difference between either dilated or hypertrophic ventricles. You can see the MUGA will help you differentiate between hypertrophic and dilated. You see dilated cardiomyopathy and hypertrophic cardiomyopathy, and that always good enough. And ask them to intake more fluid, again to excrete this diet. These are the basic things to be taught and need to be followed by the nurses. For that also most important concern in the patients. See, I have seen that most of the patients who ruled out even not with the structural diseases, who suffering with anemia, and who can able to ask you, this is a very commonest questions in the exams. Definitely we expected ischemic heart disease or heart failure, because It's a majorly, whenever preparing the questions, we think student must know, student should know. Into the patient directly, even not refer to the doctor, because patient required any modification in the medicine, patient required some investigation to be done or to be seen by the doctors, which is not understood by the nurses. Only the statement and the research statement. Yes or no? We always talk about the intervention, populations, comparison group. So your outcome should be mentioned in your statement. Same like our major concern, any of the research, any of the work needs. Thank you.